bone tumors and sarcomas, limb saving surgery, reconstruction, and cancer control. Whenever a patient walks into my clinic with a swelling in the arm or the leg or persistent bone pain, one of the first questions they ask is, "Doctor, is this bone cancer?" If investigations suggest a bone tumor, the next question is almost always, "Will I lose my leg or my arm?" These are completely natural fears. In fact, years ago, the answer was often quite different from what it is today. The good news is that advances in cancer diagnosis, chemotherapy, imaging, reconstructive surgery, and limb salvage techniques have transformed the way we treat bone cancers. Today, many patients can be cured while preserving their limb and maintaining an excellent quality of life. But not every bone tumor is cancer, and not every cancer needs amputation. In today's video, I'll explain what bone tumors and sarcomas are, how we diagnose them, the treatment options available today, and why choosing the right specialist team can make a significant difference in outcome. Hello everyone, I am Dr. Suraj Manjunath, surgical oncologist in Bangalore. Over the years, I have treated thousands of patients with different types of cancer. Bone tumors and sarcomas are among the less common cancers we encounter, but they are also among the most misunderstood. Because these cancers are rare, many patients spend months treating the symptoms as arthritis, sports injuries, or muscle pain before they receive the correct diagnosis. This delay can affect treatment outcomes. My goal today is to help you understand these conditions in simple language so that if you or someone you know experiences persistent symptoms, you know when to seek specialist care. What is a bone tumor? Let's begin with the basics. A bone tumor simply means an abnormal growth inside the bone. The word tumor often creates fear because many people immediately associate it with cancer. However, that is not always true. Bone tumors are broadly classified into two categories: benign tumors and malignant tumors. Benign tumors are non-cancerous. They usually grow slowly and do not spread to other parts of the body. Some may remain stable for years without causing problems, while others may need surgery if they become painful, if they weaken the bone, or if they interfere with joint movement. Common benign bone tumors include variants such as osteochondroma, enchondroma, and giant cell tumors. Malignant bone tumors, on the other hand, are cancers. They grow aggressively, destroy normal bone, invade surrounding muscles and other tissues, and can spread to distant organs, especially the lungs. The most common primary bone cancers include osteosarcoma, Ewing's sarcoma, and chondrosarcoma. One important point I'd like everyone to remember is this: a swelling or pain does not automatically mean cancer, but persistent symptoms should never be ignored. What is sarcoma? Many people have heard of breast cancer or lung cancer, but very few know what a sarcoma is. Sarcomas are a rare group of cancers that arise from connective tissues. These include bone, muscle, fat, cartilage, tendons, blood vessels, fibrous tissue, and the like. Sarcomas account for less than 1% of all adult cancers, but despite being rare, they require highly specialized treatment. Broadly speaking, sarcomas are divided into bone sarcomas and soft tissue sarcoma. Bone sarcomas originate from the bone itself. Examples include osteosarcoma, Ewing's sarcoma, chondrosarcoma, and soft tissue sarcomas develop in non-bony tissues like muscles, fat, connective tissues, or blood vessels. There are over 70 different subtypes of soft tissue sarcoma, each behaving differently and requiring individualized treatment. Because these cancers are uncommon, they are sometimes mistaken for simple benign lumps or sports injuries, leading to a delay in diagnosis. Here are the symptoms you should never ignore. So, how do bone tumors usually present? The most common symptom is persistent pain. Initially, the pain may come and go. Many patients assume it's because of over-exercising or a minor injury. However, as the tumor grows, the pain often becomes continuous and may even disturb sleep at night. Other warning signs include swelling around a bone or a joint, a lump that gradually increases in size, difficulty in walking or using the affected limb, reduced range of movement, recurrent fractures after trivial injuries, persistent pain lasting several weeks without improvement. Parents should be particularly attentive if a child or a teenager complains of persistent bone pain that is not explained by specific sports injuries. Most bone pain is not cancer. Conditions like arthritis, vitamin D deficiency, or muscle strain are far more common. However, pain that persists for weeks despite treatment deserves proper evaluation. How do we diagnose bone tumors? Diagnosing a bone tumor is a carefully planned process. The first step is a detailed clinical examination. We doctors ask about the duration of pain, growth of the swelling, weight loss, fever, previous injuries, any specific family history. The next step is imaging. An X-ray often provides the first clue. An MRI helps us understand the exact size of the tumor, its relationship with muscles, blood vessels, nerves, and joints. CT scans may be used to assess the lungs because bone sarcomas commonly spread there, and PET CT scans are useful in selected patients to assess disease elsewhere in the body. However, one investigation is absolutely essential before planning any treatment. That is the biopsy. A biopsy tells us exactly what type of tumor we are dealing with. One very important message I'd like to emphasize is this: never rush into surgery without a properly planned biopsy. An incorrectly performed biopsy or an operation can make future surgery more difficult and may even affect the possibility of limb salvage. This is one reason why evaluation at a specialist sarcoma center is strongly recommended. Modern treatment options. Treatment depends on several factors. These include the type of tumor, grade of cancer, size, location, whether it has spread, patient's age, and overall health. Treatment may involve one or more of the following. Surgery. The primary treatment for most bone sarcomas is surgery. Our objective is complete removal of the tumor with adequate margins while preserving as much normal tissue as safely possible. Chemotherapy. Certain cancers, especially osteosarcoma and Ewing's sarcoma, respond very well to chemotherapy, and chemotherapy may often be given before surgery to shrink the tumor or after surgery to reduce the risk of recurrence. Radiation therapy. Some sarcomas are sensitive to radiation. It may be used before surgery, after surgery, or instead of surgery in certain cases. Every patient's treatment plan is individualized. Limb salvage surgery. This is perhaps the most important part of today's discussion. Many people still believe that bone cancer automatically means an amputation. Fortunately, that is no longer true for many patients. With modern surgical techniques, a majority of appropriately selected patients with extremity bone sarcomas are candidates for limb salvage surgery, although eligibility depends on the tumor's location, extent, and involvement of vital structures. Limb salvage surgery means removing the entire tumor with safe margins, at the same time preserving the affected limb, either the arm or the leg. Once the diseased bone is removed, reconstruction is performed. Depending on the patient's age, tumor location, and the bone removed, reconstruction may involve metallic endoprosthetic implants, biological reconstruction using bone grafts, vascularized fibrillar grafts, allografts, that is using somebody else's bone where available, and joint reconstruction techniques. The goal is not only to remove the cancer completely, but also to restore mobility and function. After surgery, patients undergo structured physiotherapy and rehabilitation. Recovery takes time, but many patients are able to walk independently, return to work, and resume many of their normal pre-surgery activities. This is one of the most rewarding aspects of modern cancer surgery. When is amputation still necessary? Despite these advances, there are situations where amputation remains the safest option. This may be necessary when the tumor extensively involves major nerves or blood vessels. There is uncontrolled infection, the tumor is extremely large, and reconstruction is not feasible. Previous unplanned surgeries have contaminated surrounding tissues. Limb salvage cannot provide adequate cancer clearance in such situations. Whenever we recommend amputation, it is because our foremost priority is complete cancer control and giving the patient the best chance of long-term survival. The decision is never taken lightly, and it is discussed in great detail with the patient and the families. Why sarcoma treatment needs a specialist team? Sarcoma treatment is not just about one surgeon working alone. It requires a multidisciplinary team. This includes surgical oncologists, medical oncologists, radiation oncologists, musculoskeletal radiologists, expert pathologists, plastic and reconstructive surgeons, anesthesiologists, physiotherapists, rehabilitation specialists, oncology nurses. Each specialist contributes to planning the safest and most effective treatment. Research from around the world has consistently shown that patients treated at dedicated sarcoma centers generally have better local control, local recurrence rates, improved functional outcomes, and in many cases, better survival. The reason is not just surgical expertise. It is coordinated multidisciplinary care, appropriate imaging, accurate pathology, and carefully planned treatment. For rare cancers like sarcoma, experience truly matters. Key takeaways. If there is one message I'd like you to remember from today's discussion, it is this: bone cancer is rare, but early diagnosis can make a tremendous difference. Persistent bone pain and enlarging swelling or repeated fractures without significant injury should never be ignored. Equally important, not every bone tumor is cancer, and not every bone cancer requires amputation. Modern cancer treatment has evolved significantly. With timely diagnosis, multidisciplinary care, and advanced surgical techniques, many patients can be successfully treated while preserving both their limb and their quality of life. I hope this video has helped answer some of your questions and reduced some of the fear surrounding bone tumors and bone sarcomas. If you found this information useful, please like this video, subscribe to the channel, and share it with your family and friends. Your support helps us spread awareness and encourages early diagnosis, which can truly save lives. Thank you for watching. I am Dr. Suraj Manjunath, and I see you in the next video.